The Autism Treatment Network was started to address the medical comorbidities that many children with autism spectrum disorders encounter. Problems with GI issues, sleep issues, epilepsy, and other medical problems like that, which seem to be under-identified and poorly understood. When the network first got together, the professionals at the various sites realized that they were doing things differently from site to site in the ways that they were evaluating these children, the way that they were providing treatment for them, and how closely they were following them. We recognized early on that we needed to reduce the variability across our sites if we were going to really improve care. So we turned to the people at NICHQ for help and guidance in carrying out this mission. One of the first things that they identified to us was the need to involve more parents in our activities. Parents are crucial in telling us what's important to them and their child, in helping us identify the obstacles that they have to receiving the care that clinicians are recommending, and in helping set priorities for not only the treatment of their child, but for future research and activities across the network.
My daughter Annie was diagnosed right before she turned 2, the day before, and 3 weeks before my youngest son Ryan was born. And that was a really difficult year. I felt very alone and isolated, and basically that someone just handed me a package of information and said, "Your daughter has autism, good luck." And I had to figure out what the resources, was in the community. I had no idea what to do at all for autism. I thought autism was Rain Man. And that was it. That was my only exposure. Quality improvement work is amazing for me because I've been involved with autism work with Children's Hospital as the parent advisor for years and years now on different committees. And I love that I'm seeing the clinicians and the staff really embrace the parent perspective and really clue us in and bring us in as an equal partner. That's a huge, huge thing because 9 years ago when Annie was diagnosed, I don't know that it was that way. We've always been family-centered, but we truly are really embracing the family now. And families have so much to contribute from our own personal experience that we can definitely improve quality and improve services and, make the world a better place with clinicians together.
Our parent partners are invaluable. We definitely couldn't do the magnitude of what we've been doing or the depth of what we've been doing without them. So now it's really a real pleasure to be able to work with them and try to improve what that feels like, what that path looks like right after diagnosis, and they all share stories about how lost it felt and how alone they felt. And while we probably won't ever change some of those feelings, at least we might be able to have some tools that we can develop to ease that pathway. We are working on improving coordination of care with primary care providers as well as with schools, and by doing that we are working to get essentially within 24 hours an appointment summary sheet that goes out to the primary care providers and to the teacher so they can kind of be up to date on what's going on with the child medically, whether there's been a medication change, whether there's a concern with a medical comorbidity. So that's one of the projects we have going on, and that's going quite well. We've had really good feedback.
Traditionally, children with autism have been poorly understood by a number of communities, the general pediatric community and possibly even the specialty medical community. And so our work through the Autism Treatment Network and through NICHQ has helped us really focus on specific issues that may or may not be more common in children with autism. I think that's still being looked at, but they are definitely more problematic when they exist. Our current parent partners have been unbelievably helpful. I'm kind of overwhelmed at how much they're willing to do for us. So one example, one activity we worked on that I haven't mentioned yet through NICHQ and the ATN was standardizing our visit summaries for families after when a diagnosis is made so that we give fairly consistent thorough information regarding the diagnosis of autism and our resources in the community. Well, our parent partners read through all of that stuff that we'd had. It was just this conglomeration of phrases and paragraphs, and they edited it for us, and they put it in a format that they felt like was going to be most user-friendly to a family. We have so much work to do in fixing our systems, and as much as I value the research that's getting done in autism and the treatments that are getting studied, if we can't deliver this in a better way to families, it won't matter.
So when I started with Oregon Health Science University, my son was about 5 years old, and we took him into the clinic for an evaluation. We have been able to provide all the families that come into the clinic some support. So I meet with them at the beginning of clinic, talk to them about how their clinic day is going to go, and just let them know that I've been where they are. I can be a good resource for them if they just need support or they need guidance.
And the Parent Advisory Committee, it is our goal to help make the path through the autism journey easier for new parents. Autism is on the rise, but there's still a lot of education that needs to be done. And I think if we can bridge that gap in between clinicians, community, and family, it's going to make the process of diagnosis for autism and treatment much more livable.